Yeah, White House doctor. I didn't recommend. No, I asked him, what do you think? He said, well, if you'd like it. I said, yeah, I'd like it. I'd like to take it. A lot of people are taking it. A lot of frontline workers are taking hydroxychloroquine. A lot of I don't take it because, hey, people said, oh, maybe he owns the company. No, I don't own the company. You know what? I want the people of this nation to feel good. I don't want them being sick. And there's a very good chance that this has an impact, especially early on. So I'm taking the two, the zinc and the hydroxy. And all I can tell you is, so far, I seem to be okay.
President Trump said he has received many positive calls from people whom he did not identify, telling him about the malaria drug. He mentioned a letter he had received from a New York doctor, also unidentified, who reported giving the medicine to hundreds of patients and, quote, I haven't lost one. By contrast, the government's Food and Drug Administration warns against giving hydroxychloroquine for either prevention or treatment of the coronavirus, noting reported side effects including serious heart rhythm problems in patients with COVID-19. Only emergency use is authorized under temporary rules. Earlier this month, a medical paper out of New York suggested that combining hydroxychloroquine with the dietary supplement zinc sulfate, which has antiviral properties, could create a more effective treatment against coronavirus. But Matthew Hines, an Arizona doctor who served under Barack Obama's government, said medicines like hydroxychloroquine are not benign and open for unregulated use. The United States surpassed 90,000 deaths from the novel coronavirus and 1.5 million confirmed cases, according to a running tally from Johns Hopkins University. Take a look. The Baltimore-based Monitor registered 10,000 deaths in just 1 week, and the U.S. has the world's highest number of deaths and infections, but several countries, including Belgium, Spain, Britain, Italy, and Sweden, have recorded more fatal cases per capita, according to the statistical website Worldometer. New York State accounts for nearly a third of U.S. deaths, with more than 28,300 linked to COVID-19, according to Johns Hopkins. The state officially records about 22,700 deaths, but this doesn't include those that were probably linked to the virus, where there was no official confirmation. By June 6, the U.S. could reach around 112,000 deaths, according to an average of 20 epidemiological models analyzed by the University of Massachusetts. Nearly 11.5 million tests have been carried out in the U.S., according to Johns Hopkins, fewer per capita than dozens of countries, and about 272,000 people declared recovered. The pandemic has killed more than 316,000 people around the world since its emergence in China late last year, according to an AFP tally based on official sources. Meanwhile, the European Union backs the World Health Organization and multilateral efforts to fight the coronavirus after U.S. President Donald Trump threatened to quit the global agency. Let's listen in.
The European Union supports international cooperation and multilateral solutions in this crisis, in the pandemic crisis. I mean, I think we had the opportunity to say it several times. This is the time for solidarity. It is not the time for finger pointing or undermining multilateral cooperation.
The EU has sponsored a motion at Tuesday's session of the WHO's annual assembly to urge an impartial, independent, and comprehensive evaluation of the international response to the pandemic. Not for the first time, this puts Brussels in opposition to Washington, where President Trump has accused the UN Health Agency of being too close to China and of being too slow to react to the COVID-19 outbreak. On Monday, President Trump, who has already frozen U.S. funding for the WHO, wrote its Director General Tedros Adhanom Ghebreyesus to lay out the charges and threatened to pull out. Brussels is backing an independent inquiry into how the epidemic erupted and spread, but has tried to lead an international multilateral response to the crisis and raise funds for vaccine research. Meanwhile, New York Governor Andrew Cuomo announced that he tested negative for coronavirus after getting a live nasal swab during his press conference on Sunday. Take a look.
That's it?
Yeah.
That's it?
Okay.
Nothing else?
That's all.
Told you. Thank you very much, doctor. I'm pleased to report that I took a COVID test yesterday, and I am negative from that test. So that is good news. There's no reason why people shouldn't be getting testing. We actually have now more testing capacity than we are using at many of our sites.
Lockdown measures in New York City have been extended until May 28. Governor Cuomo said the Big Apple stay-at-home order would last to May 28 unless the city meets guidelines relating to death rates and new infections that would allow it to begin reopening earlier. He didn't explain what emergency measures would expire on June 13, but the order suggested they, in part, concerned the mandatory wearing of masks. His announcement came as restrictions were eased in the state's 5 least populated regions, allowing businesses there to get back to work gradually. In other news, Malacanang warned that Metro Manila and other areas could again be placed under enhanced community quarantine if people violate health protocols and an increase in COVID cases is seen. Presidential spokesperson Harry Roque again pointed out that the country has limited space for patients in quarantine facilities. Again, let's listen in.
Mula ECQ, naging MGCQ. Mula Modified Enhanced Community Quarantine, naging General Community Quarantine. Ang maraming probinsya at lungsod, kasama na po ang Metro Manila. Unti-unti, dahan-dahan, hinay-hinay. Pero ano pong nangyari nung araw ng Sabado? Dinagsa po ang mga malls. Parang nawala. Nawala na ang katunayan na nandyan pa ang COVID-19. Wala na pong physical distancing. Meron pa nga nagtutulakan. Pag ganyan po tayo ng ganyan, lahat ay mabibigyan hindi ng ayuda kung hindi ng COVID-19. Paalala lang po, Modified Enhanced Community Quarantine o General Community Quarantine pa yan, nasa ilalim pa rin po tayo ng community quarantine. Nandyan pa rin ang virus habang wala pong bakuna, habang wala pang gamot. Hindi pa rin po tayo ligtas sa COVID-19. Sabi nga ng isang nag-viral na post, at alam ko naman, kilala nyo kung sino siya, bawal lumabas. Pero kapag nag-comply ka at inayos ninyo, mag-obserba ng proper hygiene, tulang naghugas ng kamay, pagsusuot ng face mask or face shield, at pagsunod sa social distancing at iba pang health protocols, mapapaflatten natin ang curve at yung bawal lumabas ay magiging pwede nang lumabas.
Meanwhile, the Joint Task Force Coronavirus Shield or JTF-CV Shield on Tuesday said it will recommend the implementation of a no quarantine pass, no entry policy to ensure the observance of safe physical distancing rules in shopping malls in Metro Manila under the modified enhanced community quarantine. General Eleazar said the bottom line of the discussion is to ensure strict enforcement of the protocol on wearing of face masks and safe physical distancing, which include determining a maximum number of people allowed inside the malls based on a 2 square meters per person rule. Eleazar said that while he is certain that mall security managers also want to protect both their employees and customers from all COVID-19, all efforts could go in vain if proper implementation of protocols is not observed. India and Bangladesh began evaluating more than 2 million people as a cyclone barreled towards their coasts, with officials racing to ready shelters amid fears of coronavirus contagion in cramped facilities. Indian forecasters said Cyclone Amphan had reached winds of up to 240 kilometers per hour, with gusts of 265 kilometers per hour over the Bay of Bengal late Monday ahead of the expected landfall on Wednesday. Amphan is expected to weaken before it hits India's eastern states and Bangladesh's south and southwestern coasts, but still pack winds of up to 200 kilometers per hour, according to India's National Disaster Response Force Chief S.N. Pradhan. The Indian Meteorological Department said in a bulletin that it could cross the coasts Wednesday evening with maintained or sustained wind speeds of up to 175 kilometers per hour and gusts of up to 195 kilometers per hour. Such wind speeds are equivalent in strength to a Category 2 or 3 hurricane and would make Amphan one of the biggest storms to come off the Indian Ocean in recent years. Bangladeshi officials, meanwhile, also warned it could become the worst storm to hit the region since Cyclone Sidir in November 2007, which killed more than 3,000 people. India's National Disaster Response Force Chief S.N. Pradhan said earlier Monday that more than 1,500 disaster response personnel, 20 active and 17 standby teams were being deployed in the two states to tackle the double challenge of the cyclone and the coronavirus. Eagle News will be right back.
The South Luzon Expressway, a 36-kilometer long road that runs from Alabang to Santo Tomas, Batangas, connects several commercial and residential areas in the Greater Manila and the provinces of Laguna, Cavite, and Batangas. This will soon be extended all the way to the province of Quezon.
Mga kababayan, naharap na naman po tayo sa mabigat na pagsubok na ito. Ito yung COVID-19.
I hope everyone's okay. I hope everyone's safe.
Nandito po kami para hikayatin pa po kayo na maging matibay.
Mas maging matatag po tayo and just stay positive po sa lahat po ng nangyayari ngayon.
Mga mahal kong kababayan, lampasan po natin, pagtagumpayan po natin ang pagsubok na ito.
Stay strong sa panahon po na to.
Huwag tayong mawawalan ng pag-asa.
At inihikayat din po namin kayo na sana makinig po tayo sa ating gobyerno.
Sumunod muna tayo sa gobyerno dahil yun yung pinakamainam na paraan para hindi na lumagana pa yung virus.
Let's all stay at home.
Spend time with our loved ones, with our families.
At higit po sa lahat, make sure to pray. Pray for everyone. Pray for everything that is going on right now, especially our frontliners po who are sacrificing their lives to take care of everything.
Higit sa lahat, patuloy tayong lumapit, magtiwala at manalangin sa ating Panginoong Diyos.
Lagi tayong manalangin dahil yung po ang may pinaka-mainam na solusyon sa lahat po ng mga problema natin.
God bless you and your family. Please stay strong and keep our faith.
Tuloy po ang laban.
Welcome back. Britain's Foreign Minister Dominic Raab warned that the roadmap to ease the country's lockdown is conditional. Joining us live from the United Kingdom is Jennifer Ringwood. Hello, Jennifer.
Hi, Alma. How are you?
I'm good. Thank you for asking. How are you? Good to see you.
Not bad. It's lovely weather outside. I wish I could be out there. Anyway.
Anyways, yes. What are your updates for us?
Okay, so our updates today. Britain's Foreign Minister Dominic Raab warns that the roadmap to ease the country's lockdown is conditional on further data and the impact of changes that have already been implemented as the death toll rises to 34,796. I'm sorry, I'm tongue-tied today. Meanwhile, England's Deputy Chief Medical Officer Jonathan Van Tam explains why Britain has added a loss of taste and smell to its existing list of coronavirus symptoms. Let's listen in.
9,408 people are currently in hospital with coronavirus, which is down 13% from this time last week. And I'm very sad to report that of those who have tested positive for COVID-19 across all settings, 34,796 have now died. That's an increase of 160 deaths on yesterday. We set a roadmap, but it's a conditional roadmap, and we will monitor very carefully based on the changes that we've made over the last week and see what impact that has, and we will assess where the R rate is and the other coronavirus data is before taking any subsequent steps, no earlier than the 1st of June.
And the important thing was to work out if this would add any sensitivity to the diagnostic cluster we were using, and the answer is it makes a small, very small difference, and we have therefore decided to do it.
Britain added a loss of taste and smell to its list of coronavirus symptoms Monday and broadened eligibility for tests as it seeks to prevent a second wave of cases when the lockdown eases. Prime Minister Boris Johnson's government is racing to implement a new track and trace regime to control COVID-19. After nearly 35,000 deaths, the worst toll in Europe, a major study by King's College London last week found that people with a positive test result were 3 times more likely to report loss of smell and taste than those who returned a negative test. Report author Sim Spector said that Public Health England's previous insistence on only including fever and cough as major symptoms meant thousands of cases were missed. The World Health Organization and other countries, including the United States, also now count it as a symptom. Meanwhile, British lawmakers on Tuesday heaped fresh pressure on the government for its handling of the coronavirus outbreak, calling its testing regime inadequate and in the early stages. But despite a recent surge in daily tests, the expansion of eligibility, MPs on a parliamentary committee said testing capacity has been inadequate for most of the pandemic so far. Capacity has not increased early enough or boldly enough. Capacity drove strategy rather than strategy driving capacity, they said in a 19-page letter to Prime Minister Boris Johnson. The findings by the House of Commons Science and Technology Committee come after 6 sessions of evidence involving scientists, public health experts, and government advisors, which also looked at other countries' responses to the virus. The government has come under sustained pressure about the spread of the coronavirus in care homes and the testing of frontline health and social care workers. Official data published last week indicated that more than 12,500 deaths of care home residents were linked with coronavirus. The committee said abandoning community testing on March 12th left care home residents and workers unable to get tests at a time when the spread of the virus was at its most rampant. The Guardian on Tuesday cited an unpublished government study and said temporary workers transmitted the virus between care homes. Health Secretary Matt Hancock, who maintains care homes were a government priority on April 2nd, it was announced that 100,000 tests a day would be conducted by the end of that month. Hancock has made an army of contract tracers a key part of a new approach to tracking the spread of the virus, alongside wider community testing and the rollout of a smart app. He announced on Monday that 21,000 contact tracers have been recruited and testing has been expanded to include everyone aged 5 and over with symptoms. A new target of 200,000 tests per day has been set for the end of this month. The government aims to use data from all 3 sources to inform its easing of lockdown measures, including the partial reopening of schools. Alma?
So what was the cause of the spike in coronavirus cases? And what is the government's plan to reduce the number further?
The spike? The increased spike?
The increase, yes, the increase in cases. Is it the care home fatalities or care home facilities?
Oh, I see what you mean.
Yeah.
I was thinking of the fact that we've started to ease the lockdown measures already.
Yeah.
I think what they were saying initially is that they think that the temporary workers were responsible for transmitting the virus between the care homes, which increased the death rate in those care homes, and also that these additional symptoms that we had not previously included may also have contributed to unknowing spread of the virus, because some people had reported loss of taste and smell, and they could inadvertently have been spreaders without even knowing it, because they weren't officially on a list and would have been expected to go to work.
So, as you said, lockdown measures have already been eased a bit. So what is happening in London now? What are the new normal measures in place now in London? Are you able to go out now?
Me personally, I'm in a category where I still have to wear a mask, so I would have to stay inside. I'm in the higher category, which I've only kind of realised in the past week or so that it's that serious for me. Other people, you can go out, you are encouraged to wear a cloth face covering as opposed to trying to purchase hospital-grade PPE. And they are starting to say, especially the Mayor of London, he's been repeatedly on different media sources on the BBC saying that he is encouraging that, and now it looks like the government are also going with the same advice. Wear a cloth face covering so that you're not going to take away PPE from health services. Avoid public transport. Go to work if you are in a category where you need to go to work. And again, maintain the social distances, be alert is the key word that they keep using in every newsfeed that I've been watching.
All right, thank you very much, Jennifer, for your report. Thank you, EBC UK Bureau.
Thank you. I'm Jennifer Ringwood, reporting for EBC United Kingdom, and we live in interesting times.
Meanwhile, Russia is to begin clinical trials of the anti-coronavirus vaccine in a month. Rodora Pereche joins us live from Russia. Hello, Dang.
Hello, Miss Alma. How are you?
I'm good. How are you doing? Good to see you back.
So far, so good. Thank you. Yeah.
So your updates for us?
Yeah. Today's update, a total of 290,678 coronavirus cases have been confirmed in Russia, with 70,209 patients having recovered from the virus. Russia's latest data indicates 2,722 fatalities nationwide. Russia plans to begin clinical trials of antivirus vaccine in a month. Serious work is done to develop vaccines to preventive immunizations against the disease. It is planned to begin their clinical trials in a month. The Ministry Press Service quoted Poroshenko as saying at the 73rd session of the World Health Assembly. The minister also said that Russia is conducting more than 150,000 tests for the novel coronavirus infections a day. More than 1.4 million specialists have been retrained to treat COVID patients, and more than 130,000 extra beds have been provided. Russia stands for enhancing the World Health Organization's role as the leader of international cooperations in the public health sphere. We stress its important role in coordinating multilateral anti-COVID efforts. In order to help the WHO, we have allocated financial and methodological resources and supported its initiatives and projects. Russian experts took part in WHO's country missions on combating the coronavirus outbreak. Marashko said, "In conclusion, I would like to stress that we can stop the infection only through joint efforts." In the other news, Russia's economic woes continue to mount during coronavirus outbreak. Finance Minister Anton Silvanov told the Russian business daily Vedomosti on Wednesday that the government needed to take cautious approach to the crisis to waste Russia's $157 billion national wealth fund accumulated from years of profit on oil exports over the next 2 years. More than a third of retail businesses have been shattered. Economy Minister Maxim Reshetnikov said, with income across the sector down 25%, a total of 735,000 people have registered as unemployed over the last 2 months, and as the official unemployment rate begins to creep out. Economists remain skeptical about the true numbers of job losses given the large size of Russia's informal economy. Many, including audit chamber head Alexei Kudrin, have predicted unemployment could hit 8 million this year. In a sign of potential stress on Russian consumers, state revenues from personal income taxes, a proxy for official salaries, dropped by 14% in April. Back to you, Alma.
All right. Thank you very much, Dan, for your report. We'll see you again tomorrow.
Thank you, Alma. Reporting from Moscow, Russia, this is Rodora Peroche. We live in interesting times.
In the related news, Russia's Prime Minister Mikhail Mishustin returned to his duties after recovering from the coronavirus as total infections approached 300,000. And officials said new cases were dropping off. President Vladimir Putin signed a decree reinstating Mishustin as the head of government. Nearly 3 weeks after the Prime Minister announced on television he had tested positive for the coronavirus. Mishustin checked himself into hospital and his deputy was named interim prime minister, but he continued to participate in meetings via video link wearing a suit and a tie. The 54-year-old former tax chief was appointed prime minister in a surprise government shake-up earlier this year, but had little time to make an impact before the coronavirus pandemic hit. His reinstatement came after health officials reported 9,263 new infections in Russia over the last 24 hours, bringing the total to 299,941, the second highest in the world after the United States. The Prime Minister said that Russia had stopped the growth of new infections, but cautioned that the situation remained difficult. He credited a nationwide lockdown and systematic work over the past 2 months for slowing the rate of new infections. The Kremlin last week eased nationwide antivirus measures imposed in March, and Mishustin said Monday that dozens of regions throughout the country were ready to gradually lift lockdown orders. Tuesday's tally saw new cases fall below 10,000 for the 4th day in a row, after Monday's count saw new infections under 9,000 for the first time since the beginning of May. And Mount Fuji is officially closed for the summer due to the pandemic. Dennis Liu joins us live from Japan. Hello, Dennis.
Oh, hello, Alma. Good evening to you and to all our televiewers. Mount Fuji is officially closed for the summer due to pandemic. Officials said Japan's beloved Mount Fuji will be closed during this year's summer climbing season to prevent the spread of the coronavirus. Shizuoka Prefecture, home to the country's tallest mountain, announced they were closing 3 of the 4 major routes to the mountain's peak. On Monday, the government of Shizuoka Prefecture, one of the 2 prefectures by which Mount Fuji can be accessed, said that they will be keeping Shizuoka's 3 hiking trails that lead to the top of the mountain closed throughout the summer. Under normal conditions, the trails would have been open to the public during Mount Fuji's official climbing season, which this year was scheduled to run from July 10th to September 10th. In response to the coronavirus pandemic, though, the decision was reached to keep the trails closed. The closure affects the Subashiri, Gotemba, and Fujinomiya trails, all of which start at 5th stations, halfway up Japan's tallest mountain. It will be the first time the trails of the 12,388-foot volcanic mountain are closed since at least 1960, when the prefecture began managing the routes, he added. The decision comes after nearby Yamanashi Prefecture said it will close the Yoshida Trail, the most popular hiking path among the four. The mountain huts along the four routes will remain closed as well. The mountain, a UNESCO World Cultural Heritage Site, is located just 100 kilometers, 60 miles from Tokyo, and is clearly visible from the Japanese capital. It welcomed about 236,000 climbers last year, according to the Mount Fuji official website. Despite Mount Fuji's majesty, many complain about the actual experience of climbing it, citing the crowded hiking trails and difficult terrain. Perhaps for this reason, a Japanese proverb states, "It is foolish not to climb Mount Fuji once, but it is foolish to climb it twice." Japan's virus outbreak remains small compared with those seen in parts of Europe and the United States, with over 16,000 confirmed infections recorded and 749 deaths. Japan last week lifted a state of emergency imposed due to the coronavirus for the majority of the country, but kept it in place for top cities, Tokyo and Osaka. Back to you, Alma.
Thank you, Dennis, from our ABC Japan Bureau. Thank you for your time. Much appreciated.
Thank you very much, Alma. Reporting from Tokyo, Japan, this is Dennis Lu. We live in interesting times.
The Iglesia Ni Cristo in Hawaii conducted a contact-free aid to humanity during the COVID-19 crisis. Charmaine Sirara reports from our Hawaii Bureau.
First of all, we thank our Almighty God and to the church administration for allowing us to unite with the present activities of the church with regards to helping other people, even our brothers and our sisters. We call it the linya or aid to humanity.
Amid fears of the ongoing COVID-19 pandemic, members of the Iglesia Ni Cristo or Church of Christ in Hawaii bravely conducted a contact-free, door-to-door food donation drive for their fellow neighbors, upholding the essence of the church's Aid to Humanity program. Bags of rice, canned goods, toiletries, and other essential items were distributed in select communities throughout the Aloha State.
The District of Hawaii Pacific also helped not only those who are not members of the church, but even those who are listening to the Bible studies, and also our brethren who are in need.
Recipients were contacted in advance so as to reduce their worries towards outsiders. Others chose to have their share of free goods drop off at their front door or designated area within their property. Church volunteers made sure to abide by government-mandated safety measures, such as staggering their donation schedules and maintaining social distancing during their neighborhood visits.
We are glad to inform you that we have brethren who joined in this activity, participated in distributing goodie bags and also other necessities needed, especially now that we have the COVID-19.
In addition to the material donations, church members distributed copies of God's Message, the church official publication, as a way to introduce their neighbors to the Church of Christ. They described their magazine as a good source of hope and inspiration, especially in these unprecedented and challenging times.
We thank once again the church administration. We appreciate also our brothers and our sisters in joining in this activity, and we encourage everyone to continue to help our fellow men, not only in sharing this material things needed by our fellow men, but also the words of God, which really needed by each and every one of us to be our spiritual guide and motivation and inspiration as we continue to combat this disaster, COVID-19.
Church of Christ members in Hawaii are already anticipating similar outreach efforts in the near future, as they and their neighbors continue overcoming the crisis while striving to get their everyday lives back to normal. For Eagle News, this is Charmaine Serrera. We live in interesting times.
Thank you, Charmaine. Eagle News, we'll be right back.
Bank of Commerce. What we are is personal banking, where we understand that every deposit is your hard-earned money. Every loan is for good reason. Every service aids in your convenience. Every business of ours is meant to grow yours. We hear you, feel you, and we act on your every banking need. Bank of Commerce, an affiliate of San Miguel Corporation.
Listo at ganado ang baby ko sa vet-approved Nutri-Chunks with active boost and prebiotics na pampalisto. Made with real meat, with essential nutrients to help them grow healthy and happy. Listo, ganado sa Nutri-Chunks.
Mula noon hanggang ngayon, gabay natin ang MTRCB ratings sa matalino at responsableng panonood. Sa tamang pagsunod sa MTRCB ratings, ginagawa nating ligtas at makabuluhan ang panonood ng bawat miyembro ng pamilyang Pilipino. Lumipas man ang panahon, hanggang may pamilyang Pilipino, andyan ang MTRCB.
Filipinos in New Zealand welcome the easing of movement restrictions. New Zealand is now on alert level 1. Greg Bessa reports.
New Zealand's socio-economic activities were ground to a halt when the government put the entire country in lockdown under alert levels 3 and 4, which were aimed at eliminating the threat of COVID-19 infection. For a total of 48 days, people were strictly required to stay at home unless doing essential jobs or travels. So, when the government decided to ease the lockdown at alert level 2, people from all walks of life in this country had gladly welcomed such decision. As New Zealand made a remarkable achievement in eliminating COVID-19 for almost 2 months in full and partial lockdown, the government lowered down its alert level to number 2 starting from the midnight of 13th of May, wherein it lifted many restrictions on human interaction and movement. Prior to such decision, the number of cases was less than 3 per day for several weeks, and there were even consecutive days that registered 0 cases. No other than the Prime Minister Jacinda Ardern herself received global recognition and praises for quashing COVID-19 with only 21 death cases a small number of casualties compared to that of other Western nations. At alert level 2, people have more freedom to move around, though they are strictly required to continually observing social distancing, practicing safety and hygiene measures at all times, and to limiting as many as possible the number of people to whom they are interacting with so as to ensure easy and fast contact tracing just in case COVID-19 infection may arise. Yet, despite these restrictions, people are eager to do their shopping as retail stores and malls are reopening, to eat at their favorite restaurants and fast food chains, have their haircut and beauty parlor appointments, play with their favorite indoor and outdoor activities, visit the playgrounds and parks, and start traveling around the country. Moreover, thousands of workers are heading back to their respective offices and work sites after working from or staying at home for a while, as students at all levels are going back to schools. Much as the people are excited with what they are able to do at alert level 2, Filipinos in particular have welcomed it as they express with excitement on what they would do first at this level.
Magagawa ko na din po ang makapamasyal sa magagandang lugar dito sa New Zealand na di ko pa napuntahan. At para may baon po ako magagandang alaala sa pagbisita ko dito.
There are three things I look forward to in level 2. Firstly, I look forward to extending my bubble. That means catching up with my close friends that I haven't met for like 2 months. And secondly, I really look forward to getting some physical exercise outside, like swimming and biking. And lastly, of course, I look forward to getting life to normal by spending time, eating out in the restaurant and supporting as well the Filipino businesses here in New Zealand.
Buying a duvet because it's getting colder and I don't have that much warm blankets, and art supply shopping because I'm running out of pen ink.
Oh, definitely I'm going to get a haircut. Look at this hair, oh. It's terrible. All the white hair. So it's the hairdresser for me. As long as there's no queue anymore.
Ang una po naming gagawin, pagbaba po ng lockdown level 2, kami po ay pupunta sa barbero sapagkat mahaba na po ang aming buhok, magpapagupit po kami. At pagkatapos po noon, kami po ay maglo-long drive.
Yay! As for me, I am looking forward to having a haircut. From Wainumata, Lower Hutt, New Zealand, this is Greg Besa. We live in interesting times.
Thank you, Greg. In Indonesia, grave diggers at Pondok Rangon Public Cemetery, that is in East Jakarta, are overcoming fears and fatigue, trying to keep up with the influx of confirmed and suspected coronavirus victims. Take a look.
Kekhawatiran yang lebih besar yaitu ketika menurunkan peti dari ambulan, karena itu kan harus dipegang, terus harus mau tidak mau agak bersentuhan sama badan, kan seperti itu. Sampai dibawa ke liang lahat, kemudian diturunkan. Nah, setelah diturunkan, kekhawatiran itu sudah tidak ada.
Clashes between residents and police broke out in the poor El Bosque neighborhood in Santiago, Chile. Take a look. Now, this place is a crowded, poor area on the outskirts of Santiago as angry people wielding sticks erected barricades and threw rocks at riot police who fought back with tear gas and water cannon. People are angry over a lack of food and work amid the ongoing lockdown of the Chilean capital as a result of the coronavirus. The protest came one day after the government of President Sebastián Piñera said it would distribute 2.5 million packages of food to the poorest people in Chile. Last month, the government said it would hand out vouchers worth around $300 each to some 4.5 million low-income people, but the money was never distributed. Last Wednesday, Chile recorded a 60% spike in daily coronavirus cases despite a month and a half of preventive measures, including a selective lockdown. Last week, the government imposed a total lockdown on the capital, Santiago, which has recorded more than 80% of the country's 46,000 cases. There had also been 478 deaths as of Monday. Meanwhile, Brazil has the third highest number of novel coronavirus cases in the world, according to official figures released on Monday. A troubling surge for a country struggling to respond to the pandemic. Take a look. With 254,220 confirmed cases, Brazil has now surpassed Britain, Spain, and Italy in the past 72 hours on the list of total infections and is behind only the U.S., 1.5 million, and Russia, 290,000. Brazil has registered 16,792 COVID-19 deaths, the sixth highest toll in the world. But experts say under-testing means the real figures could be 15 times higher or more. The giant South American country of 210 million people is torn by a political battle over how to respond to the virus. Far-right President Jair Bolsonaro compared the virus to a little flu and condemned the hysteria surrounding it, and is urging the country to get back to work to stop an economic crash. Bolsonaro is now seeking his third health minister since the pandemic began. He fired the first after publicly battling over stay-at-home measures, and the second resigned last week after less than a month on the job, reportedly over the president's insistence on widespread use of the controversial and unproven malaria drug chloroquine to treat the disease. Hospitals in several areas are meanwhile operating close to full capacity, and the hardest hit cities have begun burying victims in mass graves, even as the number of infections continues to soar. Bars in the U.S. state of Texas will start reopening late this week as the Lone Star State gets further back in business, according to authorities, despite a rise in cases of coronavirus. Take a look.
Keep our distance. We stay home. We hardly ever go out, only for, essentials, food, medicine. Like right now, we just went to Juarez, Mexico to buy some medicine. I don't have insurance, because I'm unemployed, and it's a lot cheaper across the border.
I still would rather be safe than try to jump back in, because it really seems like, okay, you stopped our lives and you made us just do this thing, and now you just want us to jump back out there. But what changes have happened? Like what's different other than the numbers getting worse? It just seems that it's being pushed a little bit too hard, because it's starting to see how much money is being lost, and I don't think that should be a factor in anything if it's really that much of a concern of loss of life. I don't care how much money you're making, how are you going to spend it if you're dead?
After weeks of lockdown in an effort to curb the spread of the new coronavirus, U.S. states are allowing various degrees of reopening to address the economic devastation that has seen 30 million jobs lost. Federal guidelines call for a 14-day decline in cases before a phased comeback, but Texas is among areas going ahead, even though cases of coronavirus have gone up. On Saturday, they spiked to 1,801, the highest since the pandemic began. In Texas, under the so-called Phase 1 reopening, which began May 1, restaurants, museums, beaches, and shopping malls were permitted to get back to work, but at 25% of their normal capacity. Hair, tanning, and nail salons reopened May 8, and on Monday, it was the turn of gyms and daycare facilities. Governor Greg Abbott said he was delaying the reopening by a week for cities that are particularly hard hit, such as El Paso and Amarillo. Texas has confirmed 48,693 cases, including 1,347 deaths. In South Florida, phase 1 of reopening after the coronavirus lockdown excludes hotels, bars, nightclubs, gyms, cinemas, and massage parlors. Restaurants can only open to 50% of their capacity, and all clients and staff in stores that do reopen have to don masks, as do all passengers passing through Miami's International Airport. Governor Ron DeSantis, a supporter of President Trump, initially resisted issuing a statewide lockdown order, but after weeks of debate, he finally gave in. The reopening in South Florida is happening at different speeds in the region's complex system of counties and cities, which has led to some confusion about what is allowed where. For example, the separate jurisdictions of Miami and Miami Beach, both within Miami-Dade County, each hope to open some shops by Wednesday and to have restaurants functional by May 27. The goal is to avoid a wave of tourists visiting the area during the long weekend of Memorial Day, which falls next Monday. But Fort Lauderdale and Broward County did open some gyms and restaurants on Monday, although at lunchtime the seaside promenade was not very busy. Hundreds of workers protested in Quito after authorities in Ecuador approved a labor reform bill that aims to overcome the economic impact of the pandemic by lowering wages and working hours. Take a look.
Mandando kits a $150, llevándose más de 50.
Lentamente. Quieren esclavizar a 5 millones de trabajadores que están sin empleo con las modalidades que quieren los empleadores. Donde tengan...
Facebook founder Mark Zuckerberg urged the European Union to take the lead in setting global standards for tech regulation, or risk-seeing countries follow China as a model. Take a look.
A lot of other countries are looking at China and their economy and the companies that are coming out of there and saying, hey, that model looks like maybe it might work. Maybe it gives our government more control over different things, so it might be attractive in different ways to force everyone to localize data and make it so that just basically you don't have to respect human rights as like quite as much in kind of how the society gets run. And I just think that that's really dangerous, and I worry about that kind of model spreading to other countries.
The immense global success of the documentary The Last Dance amid the coronavirus lockdown has boosted sales of collectibles related to NBA icon Michael Jordan, some of which are trading in the hundreds of thousands of dollars. Take a look. A pair of Air Jordan sneakers worn in a game by Michael Jordan sold Sunday for $560,000 at Sotheby's auction house, an all-time record for basketball shoes. The white, black, and red shoes, made for Jordan in 1985 and autographed by the NBA legend himself, dethroned the reigning Moon shoe, one of Nike's first sneakers, a pair of which sold in July 19 for $437,000 also at Sotheby's. The latest sale highlighted the soaring market value of objects identified with the retired basketball superstar since the release of The Last Dance, an SPN Netflix documentary that chronicles the saga of Jordan and his Chicago Bulls. It also confirms that the lowly sneaker now has a place of pride in the world of wealthy collectors alongside more traditional collectibles. The pair of Air Jordan 1 is in the Chicago Colors, Air Jordan 1s in the Chicago Color Scheme, the most emblematic model of its generation, easily surpassed Sotheby's pre-sale estimate of $100,000 to $150,000. The Air Jordan 1 is the first model specially created by Nike for Michael Jordan, who wore them in his first season in the NBA. And before we close, we leave you with a word of hope. At the end of the day, there remains so much more to be grateful for. See you again tomorrow evening. Good night. I'm Alma Angeles. We live in interesting times.
This program was brought to you by Bank of Commerce, an affiliate of San Miguel Corporation. We think customers. SMC Infrastructure, building a better world. Vet-approved NutriChocs, the only premium dog food with active boost for optimum energy and prebiotics that help strengthen immunity. Just like Catherine Bernardo, gawing listo, ganado ang fur babies nyo. Listo ganado sa NutriChocs.